The Union is concerned about the impact the global pandemic COVID-19 continues to have on the continent. With almost every country on full or partial lockdown, economies are taking a toll on it. Forecasts indicate that Africa's economies will see negative growth. The impact has prompted AU Chairperson, President Cyril Ramaphosa, to appoint 4 special envoys, including former finance ministers from South Africa, Rwanda and Nigeria, to mobilise monetary support from the international community. The number of positive COVID-19 cases in the continent now stands at over 14,400. Well, we're now joined by AU Commissioner for Social Services, Amira Elfadil, via Skype. Thank you so much for joining us. So welcome to the programme. What are the biggest concerns for the AU for Africa post-COVID-19?
Thank you very much for the opportunity and good evening to all of you. Let me start by commending highly the leadership of the African Union Chairperson, His Excellency President Ramaphosa, and the leadership and the commitment of the Bureau of the Assembly. Because after this COVID-19 being declared by WHO as a pandemic, the African leaders, they acted in solidarity and they convened 2 bureau meetings. The first meeting was convened on the 26th of March. The second one was convened on the 3rd of April. So the leadership of the African Union that's been shown in these meetings, but not only that, they agreed to act in solidarity, because what we want to do here in Africa is to fight back and to have our battle, but to do it in solidarity, all of us together as 55 member states of Africa. The Bureau of the Assembly, they endorsed our common African continental strategy on COVID-19, and this strategy was discussed by our ministers of health in a meeting here hosted in Addis Ababa on the 22nd of February. This continental strategy is our framework now. It is our vision. What do we want to do in Africa to fight COVID-19? What do we do in Africa to make sure that our health systems, it will be strengthened to do this fight? How are we going to mobilize resources in Africa? So what we are doing, what we are leading through our technical institution, which is Africa Center for Disease Control and Prevention, we are leading the implementation of this strategy. Our heads of states and governments, in their meetings chaired by President Ramaphosa, they decided on establishing a technical committee, which is already being established by Africa CDC, and it includes members from all member states. But also, they requested from the Commission to establish 3 coordinating committees. One for the Ministers of Health, and this committee is co-chaired by me and His Excellency the Minister of Health of South Africa. But also we have 2 other committees. There is the Ministers of Finance, they have a coordinating committee, and the Ministers of Transport, because we need to negotiate not only the health impact of the impact of COVID-19 on health sector, but we need to discuss also the socio-economic impact of our economies. And as you just mentioned, there is a big impact happening to our economies because of this complete lockdown, because of people staying at home, and because we have vulnerable groups, we have people, they have small businesses. It is being affected. The large sector of labor in Africa is in the informal sector. So we need to discuss in a holistic and comprehensive manner what we can do about all this. To concentrate on the health issues and health impact, and to address the gaps and the shortcomings we have in the health area, but also not to ignore the other areas that is as equally or even more affected by COVID-19.
Commissioner, and I think you've said it, and we've heard the Chairperson of the African Union speak about collective responses. But the challenge is countries across the continent are differently resourced, and some are better able to respond and some aren't. Are you satisfied, because you're going to need this information, that you have enough data in terms of testing and knowing the size of the problem across the continent so that you can respond accordingly? I know for a fact that there are some countries that are just not collecting enough data, that don't know the size of the problem in their countries at the moment.
The testing is a challenge in Africa. Testing is a challenge because at the beginning we are lacking the capability to diagnose at the beginning of this outbreak. But what happened by the leadership of Africa CDC, we managed to train and build the capacity of our lab technicians in Africa, in the different member states of Africa. So when we started in January and February, we identified only 2 labs that have the capability to diagnose, which are a lab in South Africa and another one in Senegal. But today, and I'm speaking to you, we have 47 member states, they have the capability to diagnose. The gap we have with the testing kits, we know that it's not being manufactured in Africa, so we are buying it mainly from China. But the Africa CDC bought 90,000 testing kits. It's being distributed to member states. We continued with having the JACMA and Alibaba Foundation's donations. It also was distributed to the member states of Africa. Right now, we are negotiating with manufacturers in China to buy in a pool procurement process testing kits, masks, PPEs, all the medical equipment and commodities that is needed. We are now negotiating buying it from China, and we are very advanced in these negotiations. But this leads me to the resources, because you just also mentioned it. The heads of states and governments, they decided to establish a fund, a response fund, anti-COVID-19 response fund. This fund, we have already discussed and approved the term of reference for this fund. We have a decision now. Is being approved by our member states to establish the fund. It will be established here in Addis Ababa. We have already engaged the private sector of Africa. They are very, very willing to support and to mobilize resources, because also financial resources is a challenge. We need to pool our resources. We need to bring all these resources in one basket. And as I told you, the heads of states and government, they agreed to do pool procurement. Not every member state to go and start a purchasing process on its own. No, all the procurement, it will be pooled here from Addis Ababa through Africa CDC. The fund we have a seed money in the fund, because the heads of state, they decided to establish the fund. The president of South Africa pledged $6 million for this fund. The president of Egypt also put $6 million. President of Kenya, $3 million. President of Mali, $2 million. So in one meeting, in a 2 hours meeting, they pledged $17 million. So this is also to reflect the high commitment we have from our heads of states and government. The private sector also started mobilizing resourcing, engaging all the private sector in Africa. The president of South Africa, who is the chair of the African Union, also appointed 4 envoys. Yeah. And these 4 envoys for COVID-19, they will also play a big role with the wealth of experiences they have. They will play a big role in mobilizing also more resources for this fund. So I believe we have a clear vision in Africa on what we want to do. We have the political will and the political commitment of our heads of states and governments, and we have decided where is the gaps and how are we going to address these gaps. So I believe we have challenges, but we are on the right track on addressing these challenges.
All right, and that's where we'll leave it. Thank you very, very much indeed for that update and giving a sense of what you're able to do at this time and what your hopes are going forward. Thank you so much indeed, Commissioner.
You are welcome.
Okay.
Thank you for having me.
Shukran.